It is now likely that most adults in the state are eligible for their shot. To get to this point, state health officials have made some tough decisions on who comes first. Madeline O'Neill digs deeper into how they determined this order of eligibility. Maddie?
Well, I've heard from people who are frustrated that they're not eligible yet when it seems like nearly everyone is. But I've also heard from people with underlying medical conditions who are relieved and thrilled that it is finally their turn after living in fear for a year. Now, the state has acknowledged that the prioritization process isn't easy and won't be perfect when balancing who needs the shot most with trying to get it out there quickly.
Hi, I'm here for an appointment.
Steve Gorton is used to facing a well-worn road.
Kind of like we're stuck in the movie Groundhog Day.
Stuck at his Fitchburg home during the pandemic, getting well acquainted with Zoom.
Where we just keep repeating every day.
Like many others with underlying medical conditions.
It just drives the anxiety up.
That includes Sauk City's Karen Koss, afraid to venture out at all.
I got harder as time went on. I'm chomping at the bit because you know it's coming.
The shot in the arm that can get us out of the loop and onto another path.
Oh, I've been pretty anxious to get the vaccine.
All right, great. Thank you.
One that leads to protection.
The ultimate goal is move vaccine into arms as quickly as possible.
Who goes first down that path? And how do we decide?
Vaccine is not as scarce as it was.
In the beginning, when supply was far more limited, that line had to be narrower. Wisconsin started with Phase 1A, including frontline healthcare workers. Then Phase 1B opened up to those over 65 and some occupations, including teachers. Now with Phase 1C, the Department of Health Services wants to prioritize people with high-risk medical conditions.
They need it. They are at risk. They are anxious about this.
DHS included conditions the CDC says do put people at higher risk for severe illness from the coronavirus, such as cancer, heart conditions, and obesity. They also included conditions that might, such as asthma, high blood pressure, and being overweight, bringing an estimated 2 million more people into the vaccine queue.
We're getting much closer to being able to have supply to open up to everyone, so it didn't worry us that we were putting a larger number of people in the group.
DHS says the decision was based partly on insight from the State Disaster and Medical Advisory Committee. The committee hasn't met since January, and while they only submitted formal recommendations for Phase 1B, members spoke about prioritizing people with high-risk medical conditions and certain essential workers in future phases. While the CDC recommends including essential workers, such as those in manufacturing and housing construction, before the general public in Phase 2, DHS is not including any additional job groups in our state's Phase 1C.
We just felt like continuing to create eligibility by occupational group is confusing, and many of those employees are now eligible because of the chronic health conditions.
I can't even describe it. I'm sleeping better already.
People like Karen, whose niece helped her schedule a vaccination appointment.
I'm just happy.
And Steve, who's now on his way to immunity after his first shot.
Perfect.
All right, it was just a little poke.
Regardless of where you are in line, DHS says the bottom line is everyone 16 and up will be eligible soon.
Brief amount of time we still have to get through this. And we've already got a year into it, so don't blow it now. Okay.
DHS says they determine how to move to the next phase of eligibility based on how many in the current group are getting vaccinated and how quickly, along with how much supply is coming in. Now, we're expected to move to Phase 2, which will open up things to everyone over 16 in the state by May 1st, but that could come earlier if everything goes well.
Maddie O'Neill tonight. Maddie, thank you.